Walatu, Walasa, Yadi, I want so.
Hello, cherished viewers, and welcome once again to Walatu, Walasa, your Labor Digest program here on Clock TV, Beyond the Policy. I am your host, Edmond Akwe. Today's episode focuses on a critical group of professionals who worked behind the scenes of Ghana's health system, and their work has a direct impact on every hospital, every patient, and on the nation's public health system at large. We are shining the spotlight on the Government and Hospital Pharmacists Association, also known as GOSPA. Beyond the white coats and prescriptions lies a powerful story of service, sacrifice, and persistent advocacy. This group of workers are professionals who ensure the safe delivery of medicines, manage complex supply chains, and play a silent but strategic role in our national health care delivery system. Despite all the above mentioned, their journey has not been without struggles, from delayed recognition as a union to pay and salary disparities and placement challenges within the public service structure. Helping us to tell this story is a seasoned labor advocate, a leader, a personality who has worked tirelessly to raise the voice of pharmacists within Ghana's health sector and the labor front. He is the Deputy Chief Pharmacist at the New Ibrahim Government Hospital and currently the General Secretary of GOSPA. Viewers, join me to welcome Mr. Frederick Yadom Dafor to Walatu, Walasa. Sir, you are most welcome.
Thank you very much.
Clock TV and to Walatu, Walasa, your Labor Digest program.
Thank you.
How is everybody?
By the grace of God, we are all doing fine.
Great. Your union, the leadership,
we are doing great.
the members.
I would say the grace of God is sustaining us, and so we are fine.
Very well,
Yeah.
very well.
Yeah.
Well, Walatu, Walasa is your Labor Digest program. And what we seek to do today is for you to tell us about your union, for you to tell us the formation stage, the struggles, the success, and the current status quo of GOSPA. That is Government and Hospital Pharmacists Association. So when we talk about GOSPA, which group of people are we talking about? Which group of workers or professionals?
Thank you very much. So GOSPA actually, as the name suggests, is Government and Hospital Pharmacists, and that has come together to form this association. And so our composition is basically all pharmacists, I would say, in the public space.
Very well.
But not only the public space. When we talk about hospital practice, then you also have some private hospitals, and we have pharmacists there. They are all supposed to be part of the association. Mm-hmm. I acknowledge that as of now, not all of them are really enrolled. But in principle, all pharmacists, aside those in the public hospitals, those in private hospitals are also members of GOSPA.
Very well. So how about those also managing petty, chemical shops, pharmacy shops and all that?
So by this, we can now set the clear distinction between GOSPA. But we have our mother association, which is the Pharmaceutical Society of Ghana. That is the mother body. And, pharmacy is so huge, so huge in terms of practice groups and various aspects. And so the Pharmaceutical Society embodies all these various groupings of pharmacists, or let me say professional, branches of pharmacy practice. Because GOSPA is basically hospital practice. But then we have others who are in what we call medical representation. As P, we have those in regulatory matters. we have pharmacists involved in academia, our lecturers in the various pharmacy schools. They also form another group. And then we have I've mentioned how many? I've mentioned those in academia. We have those in academia.
Those who are in the hospital practicing.
We have industrial pharmacists. Those in production. We have industrial pharmacists and all those groups. So all of us come under. In fact, we even have research pharmacists and all that. And so we are one body under the Pharmaceutical Society of Ghana. But so when you come into the Pharmaceutical Society, then we have the various practice groups and interest groups. And so GOSPA is one of the practice groups of the Pharmaceutical Society of Ghana. And so that is where the difference comes in, but we are all pharmacists.
Very well said. So if we may ask, or I may ask, when was GOSPA formed, and what led to the establishment of a union called GOSPA, or association called GOSPA?
All right, thank you very much for this one. GOSPA has a very long history, and its formation, let me say that I would describe an old GOSPA and the current GOSPA.
I like that difference.
The current GOSPA, because I would say that GOSPA has been in existence for very long. In the health sector, the Pharmaceutical Society generally is the first to actually, form, to come up, even far ahead of our medical friends. Simply because, when our colonial masters came in, they brought in doctors from abroad. And what they did was to train some of the nurses and some other staff they were using to dispense. And so they became dispensers. They trained them on the job. And then they were dispensing for them. And even their training went a bit further into even training them to be able to give jabs in terms of injections. That is what they were doing. But along the line, the need to properly train pharmacists came up. And so in the then Kumasi Technical College, which was the foremost technical
for pharmacists.
For pharmacists, but it wasn't the only for pharmacists. The foremost technical school in Ghana then was located in Kumasi, which has now grown into KNUST Tech. So that is where the formal training actually began, and pharmacists were trained from there. So from that training, we began to have a few pharmacists in the system. So somewhere along the 1970s, that is when actually hospital pharmacists started grouping for the purpose of seeking their welfare and all the other labor issues in there. And so I'll describe that as the old GOSPA. And the problem with the old GOSPA was that they didn't have much of a voice because of their numbers.
Very many?
Very many, very, very few. When you check through our records, even around 1980 thereabout, you could count as low as just about 80 pharmacists who were in the public space.
That's amazing.
And so that tells you how few we have been. And in fact, even in terms of today, when you compare our numbers with respect to our other colleagues in the health space, you could see that we are still
in the minority.
Does
that mean that people are not studying pharmacy?
A lot of people have studied pharmacy, but the opportunities in the public space have been limited. It has not been enough. Government has not been picking up enough pharmacists. And if we even go into that side, you realize that per the staffing norms of the Ministry of Health and the Ghana Health Service, we are told even from the last labor market survey that we have only 36% of what we need as pharmacists in the public space, and that should tell you the gap that exists in terms of numbers of pharmacists that should be working in our public hospitals and in a public space. So that has been the issue. And so that was the problem of the old gospel. And then, in the public, in the labor space too, there were a lot of issues. Okay. For pharmacists, the private practice is a key factor. And because government work wasn't that attractive, a lot of people went, even up to today, we find a lot of pharmacists going into private practice, having their own businesses here and there, running pharmacies and serving the community, which is also something very, very important. But we need a lot more in the public space. Yeah, and that has not been happening as expected. So with this, hospital practice was not attractive. Okay. The remuneration was low. So
from the 70s down to the 80s to the 90s, yes, it wasn't that attractive.
It wasn't that attractive. And then there was a time that there was a certain government order. Okay. So in fact, we have a certain term that we call government orders. Okay. And what it was virtually seeking to do was to ensure that pharmacists who were employed in the public space remained in the hospitals and worked. Because if they added private practice, it meant that they work for up to a certain time in the day, and then they have to leave and go to their private practice. So government orders that pharmacists in the public space shouldn't go into private practice. And then instead of that, or in place of that, some allowances will be given them.
Were these allowances given?
It was being paid, but if you compared what they were getting to
the private space,
very good. Then you realize that there is some, shortchanging that a lot of people were not happy about. So these things went on, and after a point in time, it brought about. So I'm sure as we talk about our struggles and definitely that will come into play. So these things went on until in the early 2000s. Okay. Specifically around 2003. The PSGH, which is our mother association, fully recognized gospel as one of the practice groups of the association. And that is a period that we can see the new gospel actually
started coming to the limelight.
Yes.
Who are some of the pioneer figures that you could mention?
The pioneering figures that we have Farm Philip Anum, now Dr. Anum. He's retired though, but he was one of those. He was our very first leader of when we talk about the new era of gospel. He was the first leader. He was the first chairman of the association. And then further down we had Raymond Tete, very vocal, very strong, well known. I believe, as I mentioned,
the name rings
it does ring a bell. And then after him also came Steve Kokwe. We have had a number of leaders. Steve Kokwe took the front. Farm Ajimambedu,
the giant.
Yes, that big man, and then Ajimambedu came in, and then we had Nathan Kumsin.
There hasn't been a woman. You've not mentioned any.
No. We've not had a lady coming out. Unfortunately,
all pharmacists are not men, right?
No. We have ladies. But the labor front is not an easy one, and I'm just, with time we hope to be able to groom ladies. Very well. At least, even if we are not having a chairman, a general secretary who is a lady, I think that one is very possible. These things.
So these are some of the pioneering figures who were able to champion for us.
So if I'm mentioning the earlier men who actually worked to ensure that we have the gospel, modern gospel as we have it now, then I can mention Farm Dr. Philip Anum. Yes. Now Dr. Raymond Tete. Good. And then Steve and Ajimambedu. They are people who have fought hard and have ensured. And I must mention that In fact, even the immediate past and the current chair, they have also been in the fray. They have been in leadership, and so they have also made some significant, very, very important contributions to the growth of gospel and what we see gospel to be today. So this is how far, I think, from the earlier times, in colonial times, when they started aggregating, but especially in the 1970s.
That was when the shake-up was more.
Very good. And then the hospital pharmacies came together. But because of their numbers, they didn't have much of a voice. But in fact, from 1988 thereabout, when certain struggles actually started, these government orders and all those things that we were fighting.
The famous government order.
That is when the new gospel actually started brewing. But by the early 2000s, it has taken shape. And we have what we have today, as we see.
So how is enrollment like when it comes to...
Yes, enrollment automatically, if you get employed or taken up by government, especially into hospital practice. Because ideally, you should have involved all other government pharmacists. And so if you were even in the FDA, the Pharmacy Council, you may not be in hospital practice, but you are in the ministries, in the DHS headquarters offices, then you were automatically supposed to be a member of GOSPA.
So the work of the pharmacist, what is the scope of the work of the pharmacist?
The work of the pharmacist is a very big one. It encompasses a lot. And I guess that the basic thing that the public sees may usually be the prescription, the serving of prescriptions that they see over the counter and all that. But there is a lot more that pharmacy. If you are taking pharmacy practice in general, then just as I've mentioned to you, you see we have production pharmacists, those who are in industry, producing the medicines for us. We have those in regulation, ensuring that the standards are adhered to and all that. And so the Pharmacy Council, the FDAs and the rest, they are there. There are a lot of pharmacists working in these spaces to ensure that these things are working. There are pharmacists in policy making, but when you come to hardcore pharmacy work,
I think that is the one that we, the general public, can be contact with. So let's say I go to a hospital, after a doctor has sent me, giving me a prescription, they say take it to the pharmacist there too. Now I see the pharmacist, I give it to him. What the doctor wrote, this question a lot of people would be wanting to ask. What the doctor wrote is long, something, Yet the pharmacist sees and is able to read. What's that link?
So it's an important one. It's an important one. We are the last point of call in the health delivery services. And when I say last point of call, what I mean is that we are at a very critical point. If somebody comes to the hospital, is seen, and whatever will have to be done for you is done. And suppose, doctors make mistakes, nurses can make mistakes
as well.
Mistakes can happen. Because
as humans.
As humans. But the critical point that when a mistake is missed, it means anything at all can happen. It's at that point. It's at the point of the pharmacy, because you come to the pharmacy, and the most likely thing is that after you being served, the next is that you are going home. You are going home with all the instructions that you have been given based on the prescriptions that has been written for you. And so that is a critical service that we render. And you just talked about the prescription that the doctor writes here. Sometimes they write things that you can't even see. And the pharmacist might turn himself into somebody who deciphers handwritings and to actually
doctors always have that kind of handwriting.
I'm telling you, so they have horrible. I must say horrible handwriting.
But you understand?
We have been with them, so you with time get used to some of the things that they try to write.
For me, when that is done, for me, it's magic because you're looking at the prescription and yet not understand, but the pharmacy picks it. Immediately
you have to look at it and then be able to decipher what has been written down and exactly interpret it. So basically, I was telling a group of people and some of my non-pharmacy staff at my hospital that, look, this work we do, if you don't take care, you might even think that it is something ordinary.
Yeah.
But the kind of thinking that goes into it, professionally, it's not something that you can take for a ride, because a doctor brings a prescription, and in the space of some minutes, I have to be able to look at diagnosis and look at a few of the presenting complaints and everything, and be able to judge that the diagnosis is on point, and the choice of medicines and the dosing of these medicines, duration of these medicines are also on point. And if there are any issues that are not too clear to us, or let me just use the term, not making enough sense, you will have to contact the prescriber, discuss your
feelings, your ideas,
your issues, what you are picking from what is before you. You want to understand him, his reasoning, purpose for whatever has been prescribed, and then you can share your professional opinion. If there are issues, maybe with clarity on his side, you can agree that, what you have written is okay. Or sometimes you want to suggest that, I think under the circumstances, we need to tweak things a little. This one can be changed to A, B, C, D, or we can do better with the dosing and all that.
If that is what goes on sometimes, it means that the pharmacist is near to somebody who really understands the medications and goes on to know the cure.
No, when we talk about the pharmacist, then we are talking about the expert in medicines. Right? So the doctor is an expert in diseases.
In diagnosing.
And that is how come they diagnose. They may prescribe, but because the pharmacist is the expert, he is always able to see if there are any issues with prescriptions, draw attention, and then put in the necessary interventions. If there is a need for changes anywhere, it becomes our responsibility to get in touch with the prescriber and explain issues to him or her, and we come to an agreement that this is what is best to be done for our client, and then we do that. There are times that prescriptions come and the formulation or the form, the dosage form required is not even available. And you have to take tablets and try and formulate them into suspensions or syrups.
For it to work?
Yes, for people to take. Especially if you have certain medications that a child needs, but you don't have dosage forms for children. Because there are times that a child will need something like frucimide, but that child cannot swallow a tablet. There are times that the folic acid must be formulated into a syrup for a little child to take. There are several
instances that the pharmacist must,
and we have to do that, prepare that for our clients. So it's not only about tablets and dishing them out or bottled products that we give out, but there are times that we have to also do preparations ourselves, or reconstitute, or do other stuff for people in order to.
That's great. So from your submission, you realize that within the health sector space, pharmacists cannot be ruled out. Are you giving that recognition? Because we the general public would always see, I went to the doctor. Do you understand? That somebody say, it was the nurse who, gave me the injection. But the injection was applied by the pharmacist.
Sure.
You get it.
Exactly.
Are pharmacists really recognized within the public health sector?
I would say that it has been very bad, but probably with our advocacies and our presence now being felt a little bit more, people are getting to understand what we do, and they are appreciating the work of the pharmacist a lot better than it used to be. Because so some time ago, when patient came and you will probably withheld their prescriptions and told them to wait because there is work to be done on their prescriptions, or you need to verify things with a prescriber and all that. You could have a patient tell you about what do you know? A doctor has written a prescription. All you have to do is to just serve it. And say, no, you don't know what we do. That is why you are talking the way you talk.
Yeah.
But now people see the service and they are appreciating. Then again, you see, pharmacy practice has actually evolved. It has evolved. The face that people used to see in those times was more of the dispensing. Take one in the morning, afternoon, evening, and that is all. But now it is more clinical, more practical. And it's not only about dispensing, but we now are found on the wards.
Okay.
We go on ward rounds with doctors.
Good.
And when therapeutic decisions have to be taken, we're also there to contribute our knowledge and our understanding of the situation.
Okay.
And I must say that some doctors have been very open, and they have seen the usefulness of pharmacists around them.
Good.
And a lot of them would not even take certain decisions without, especially on medicines,
without consulting
their pharmacists, because they see the services we render in that direction.
Yeah.
And that is the line of work that we now want to do. We want to ensure that we are everywhere, especially on the ward, because that is where we were not found at first. Because people used to know us in our cubicles,
all the medicines
but then, I mean, the practice has actually evolved. It has changed a lot. And even starting from training, it has changed.
So are students enrolling to be pharmacists? Because the ultimate is to be a doctor.
A lot. A lot. There are a lot whose vision and aim and desire in life has been to become pharmacists. And they are pursuing that.
Yeah.
And I can tell you that formerly it used to be a Bachelor of Pharmacy program, but now it is PharmD, Doctor of Pharmacy, 6-year training, practical, ward work, and all those things. And these are the things that have actually changed the face of pharmacy practice. And so I would say that, yes, we don't think that we are recognized enough as we should be.
But it is improving. We'll go for a break, and when we come back, we'll be looking at gospel and the struggles with getting certain, incentives for your members.
Thank you.
And your relations with other labor unions.
Right.
We'll be right back. Walasa, your Labor Digest program. We have in our studio Mr. Frederick Yadom Dufour, the General Secretary of GOSPA. Now, Mr. Dufour, let's look at GOSPA. Okay. Every union have their defining moments. Okay, some of the things that you have to struggle to fight for your members. What are some of the achievements so far you've been able to achieve for your members when it comes to dealing with your employer to give you all what we all know, the best remuneration that we want?
Right. Thank you very much. Yes, you know, the labor front is always full of struggles.
Yeah.
Because it's a lot of the time about what we see as good for us.
Yes.
And what government sees as
that what I can give you.
What I can give you.
Yes.
And this is what usually brings about the struggles. Let me say in earlier times, especially the government order was one big problem for pharmacists, which actually brought about some strike in the 1988-89 period. And that was basically to fight until this issue of not allowing hospital pharmacists to go into private practice, some way, somehow, along the line, was resolved. Yes, it was a major issue. Okay. Because along the line, you know, salaries and all those things in the public space, especially in our health sector, let me say that in earlier times, there wasn't any proper structure, but we depended on relativities. We depended on relativities. But with time, you don't know what happens. Things have been set in place, relativities have been set. And so if a medical doctor ends A, a pharmacist automatically knows that he's going to get this B based on the relativities that existed. But with time, these things got distorted. And so it was also part of the struggles of the 1980s into the 90s. And I think that is when a leader like Raymond Tete actually came. They joined that struggle and helped a lot. But let me say that gospel has actually done a lot. You know, for instance, with the introduction of the Almighty Single Spine, you know, there were issues. We felt that our placement wasn't right. It wasn't really correct. We felt shortchanged. It was lower than what we thought it should be, and so we had to fight. And I remember from somewhere in November 2011, we had to go on strike. Oh yes, we had to. Went on strike. Yeah. You know, you don't normally go on strike. We don't normally have to do that. We don't normally do that. But we were forced to because in account they say one kasa utriwa yebeyu yibone, which means that if you don't speak up for yourself, the barber, when you go to the barber and they are barbering you, and he may be giving you a certain cut that you may not like. You have to give instructions. You have to tell him that do it this way for me, do that. Otherwise, he gives you a cut. You come out and you realize that you don't really like what you are seeing, or people are making fun of you. So we had to come out strong and talk about that. Usually, you know, government, when the strike is now biting, then they will come in and offer that, you should come to the negotiations table. You know, sometimes when these issues pop up, they are not even giving you the opportunity to sit with them and even talk about it. Come to a agreement. Most of the time, when you are invited to the negotiations table, it becomes a point where you want to tone down and maybe sit down with them and see what comes out of it. Some things were done, but still there were adjustments. Yes, some adjustments were done, but it was still not satisfactory. We went along with it. There were some outstanding issues, and so after waiting for almost 4 or 5 years, we were not seeing the headways on those things. And so in August 2015, we rose up again. We rose up again. Strike history. We rose up again on market premiums and all those things. And some there too, by the grace of God, we were able to, when we started talking about that issue, government was kind of silent. They were not acting. Why would they? Sometimes you don't know. You see, like I told you, unfortunately, we are at a position where our services may not lead to direct deaths. Very well. And that is what.
So they don't see you as essential service group.
It would be wrong to say we are. I believe anybody who works in the health sector, and especially in the hospital, it's essential. And so as for that argument, I doubt that was what was in their minds. But they want to play along with you, and see whether they can wear you out.
As for pharmacists who are
and our numbers too. We're not big
in the government's settings.
We're not big, so then in battle, in war, numbers count.
Yes.
And those were things that were actually working against us. But when we actually, in September 2016, when we actually withdrew services totally. And now
the strike started biting.
Our HIV clients were suffering because we were not there to do the dispensing for them and the usual things that we help them through TB medications. The pharmacists were not there. Clients were not receiving them. And you know how critical these conditions are, especially TB or its contagious nature. You always want to,
curb it in a way. The pharmacist must be there.
And so it was only with these disruptions in services that government was now willing to invite us back to the
negotiation
table,
to listen to you,
to listen to
how important you are.
And so the picture started changing from those points. So there has been a lot. In fact, along this period, we have been able to, formally we didn't have a proper job description from the ministry and the Ghana Health Service, but the association worked on these things. We have proper job descriptions, schemes of service.
Something has been put in place.
Yes, when you have these things, then your value can really be determined and determined well.
Yes.
And so if you don't have them, it means that people determined what your value is. That for them,
shouldn't be the case.
No.
Yeah.
And so one major thing that actually has been accomplished through this period has been the job description reform that we did in 2019.
And that was a success.
Great. That was a success. And so these are some of the things that have gone on. Successfully, we have tried to use more of advocacy than the agitation.
Because for me, one of the things I know about pharmacists is that they're always having workshops. They're always doing some programs, something. And I think that is very good.
So we have tried to use
advocacy is one of the things that
we have tried to use that means also to kind of advance some of our labor concerns. We have just thought that, along the line, it's sometimes also good to talk to Jojo, see the right people, let them get to know the issues so that they can take informed decisions. And I think that one has also helped a lot. And so, by and large, we can say that gospel has done a lot. You see, that is even from our part. But when you look at, I don't know whether you want us to even look at nationally.
Yeah, nationally. I was
some of the things that has happened along the line is contributing positively to health policy advocacy. And one of the big things that we do, that it relies and solely lies on pharmacists, for instance, is the antimicrobial stewardship. Because antimicrobial resistance is a big issue in healthcare today. And when we lose our antimicrobials, I'm talking about antibiotics in particular, when we lose them to resistance, it means that we don't have effective medicines to fight infection. And so pharmacists are in the forefront of this fight to ensure that we protect our antibiotics. When you come to Ghana right now, when we talk about medication errors, we all know it's something that happens worldwide. And we are talking about human beings doing working, so errors are bound to happen. But we are making savings because now we are actively looking out for errors, picking them and reporting on them. And once we pick an error, it means that it is going to go back for solution. You correct them, and ensure that they are not reaching our clients. And so these are some of the areas in which we are making impact nationally, and we are saving the country a lot. When you even check on the net, you will see. I don't know whether this is about $18,000. I mean, one study, a small study that was carried out, did some estimates, and you realize that something that could have been around $18,000, or is it 18,000 Ghana cedis, but because of the intervention of pharmacists in detecting medication errors, we saved.
It reduced.
No, significant. Even if it is in terms of Ghanaian cedis, say 18,500 cedis. Okay. But because I'm detecting medication errors, I'm able to reduce it from 18,000 to only as much as just 2,000 or something. So I made savings of about 16,920.
Which before could have gone into cost.
Just like that, because it meant that people were going to incur costs. They may stay longer in hospital. Their conditions, they may go through even worse things because of some of these errors. And so these are things that we are doing that is actually contributing economically to the nation, to the health sector. These are important achievements.
It is. You cannot,
GOSPA has chalked.
So I want to know, what is the relationship between you and, let's say, your mother Ministry of Health? Ghana Ministry of Health. With the pharmacist, GOSPA, a strong association.
I think that, like I said, the problem that we had with the general public also existed in those spaces
as well.
But thankfully, with time, the work of the pharmacist has been fully appreciated, and this has changed. And so, to a large extent, I agree that even though we still have some problems, I think the recognition now is there. Yes, is there. From the ministry to the Ghana Health Service, the place of pharmacists is well understood.
How about other stakeholders? Let's say Ministry of Employment, and other stakeholders that you work with.
Yes. The recognition is there.
The nurses.
The nurses know that we are there, and they know that we are a critical part of the work that they do. There are times that we have to even actually collaborate with our nurses. There are times that we have to give them a little education on how to use home medications. We develop protocols with them on the use of medicines here and there. And so as for that, collaboration is there. Health delivery is a multidisciplinary area. I don't think any one of us can work on our own. We cannot be islands. We need to work together. And so definitely that is something that is ongoing. We are collaborating very well to improve the health of our nation.
Very well.
So from the ministry down through, right now, I think the recognition is there.
There's a cordial relationship.
There is a cordial relationship. No, sometimes, let me say, certainly, our space is
really limited.
You see, right now, it's something that is not really being said, but it exists. The space is captured strongly by one group of professionals. And so you understand. It does skew things in a certain direction sometimes. But then generally we have to agree that the recognition is coming up. Though we think that our work should be recognized better than it has been done now. But by and large, we are making progress in that direction.
You get there.
Yeah.
You get there.
Yeah.
Now let's look at gospel in the Ghana's labor front. Okay. What has been some of your roles in the labor front, and which are some of the labor unions that you affiliate yourself with?
Oh, for our roles, yes, we have been part of some struggles here and there. I think that there were times that some things went bad, and in the health sector we have the Health Services Workers Union. And sometimes we needed to team up with Health Services Workers Union and then the Ghana Registered Nurses and Midwives Association.
GMA as well?
Yes, GMA, yes, we do. There are times that we needed to collaborate on some issues and bring it across to government. And usually when you see that combo coming, then you should know that
it's a strong force.
It's a strong force. And so that is how we have collaborated. You know, we are part of Forum also. We are part of Forum. So we have the health sector unions.
Which you are part?
We are part of that.
Very well.
We are part of Forum. And generally
Forum for public sector, workers.
Forum for public sector workers, and then generally, we are part. We are TUC. So we have been playing our roles within this space as much as.
And when it comes to overall, you are part of organized labor.
Organized labor. Okay. And this is where we find.
You have some international affiliations.
Not yet, but we. Generally, we are part of the Federation of Pharmacists, International Federation of Pharmacists, FIP, pharmacists. We have that collaboration there. The PSGH, which is the mother body in general, have this affiliation with the Commonwealth Association of Pharmacists. So we work within that space. But for gospel, not directly, but we have these international bodies that we are part of, and in FIP we have the hospital practice, committee that is there, and the idea is to work to improve hospital practice across the nation. So, those are some of the collaborations and positionings that we have
so far. So far so good. You are part of a strong labor group in Ghana. Let's look at gospel and what you think should be your current priority when it comes to advocacy in itself.
Looking at priorities, we have quite a number, because the realities today are that we still think that we are not adequately compensated for the work we do, especially on the single spine. This market premium after a year or two was frozen, something that is supposed to be increasing based on your base pay. It's not happening. These are all issues that we have, but currently so let me just enumerate
a number of them.
Yes. When you talk about priorities, we have a few that we want to talk about.
Put across, your members are listening.
We are still.
Government is also listening.
Yes, we are still fighting and asking that we be properly remunerated, and that is a priority for us. And then a full implementation of conditions of service. Sometimes you negotiate conditions of service. You are given certain, provisions. You have certain provisions are made for you, but you come on the ground and it's not there. It cannot be implemented, or it is not being implemented. And so we are working around to ensure that these things are done. We have detected some gaps in some placements of some of our people, and we are working along the line with the Fair Wages and Salaries Commission to deal with some of these problems. So one thing is that we have a job description.
Okay.
That needs to be implemented, a very new one, because, you know, like I was telling you, training has changed.
Yes.
Practice focuses have shifted.
Over the years.
Yes. We don't just do Jibakwanopa
again. It's past and gone.
Yeah. We do a lot of things now.
Yeah.
I'm supposed to, even as almost like a single pharmacist, I have just one other person assisting me. I have to be able to go on the ward, do what we call pharmaceutical care plans, as I identify pharmaceutical care issues, and develop plans, and then monitor and see how well our clients.
So more duties have come to add up to your duties. So are you asking for extra allowance?
A whole facility that must have about 6 or 7 pharmacists, and we are only 2. Then you can imagine the workload.
Number of prescriptions.
And you see, aside doing core pharmacy work, if you're a manager, you are doing administrative work in addition. You are managing stocks here and there. And all these things are quite a heavy burden.
Yeah.
Quite a heavy burden. And that is why we think that we should be properly... so we are looking forward to full implementation of our new job description and revised conditions of service. One important thing is postgraduate training for pharmacists. We think that where we are heading now, specialization is key. We think that government should be ready to sponsor pharmacists to further our education. At the end of the day, who does it benefit? Ghanaians. If you have special skills, you use it to the benefit of our citizens. And so government must actually support that work. We are looking for opportunities because now GOSPA as a union has pharmacy technicians with us.
Yeah.
And so we are looking for opportunities for them to also be able to upgrade themselves. And become better people in the space.
To serve the public.
We are looking for capacity building for clinical pharmacy services because now it is the way to go. We are doing more clinical work. And so we think that we should be able to build capacity in that direction. Government should be involved as much as GOSPA tries to do something. There should be regular workshops and all those things to help people, grasp modern ways of doing the work. At the end of the day, to ensure that our nation is healthy.
On the health sector level. Thank you very much. We'll go for a break and we'll come back. We'll be rounding up. We'll be looking.
This is how we do. M-I, Divalist, a.k.a. You know the name?
Ghana music has really been has really been doing great stuff.
Whenever Mr. Drew's on stage, it's a blast.
Are you ready to dive into the heart of entertainment? Let's start, where we explore the latest trends in the entertainment industry. From viral moments to hottest celebrity stars, we've got you covered. Have questions? We want to hear from you. Your voice matters. Let's vibe together.
I gotta say, do you wanna hear it? You're always on my mind.
Welcome back, viewers, on your show Walatu, Walasa. We've been looking at Government and Hospital Pharmacists Association, their evolution, how far they've come, and their way forward. We've been in the studio with Mr. Frederick Yadom Dafor. Sir, thank you very much for your insights. Now, I want to know, what is the vision of GOSPA in the next coming years?
Thank you very much. Yes, the future, as we are looking at, is bright, but it will be brighter if we put in place all the necessary, elements.
Elements.
Yeah. And so for our vision for the future, one important thing is that we need the numbers to make work in the hospitals better, well improved, and quality-wise. And so we'll be collaborating and working with government to ensure that a lot more pharmacists are trained. As for the training, I believe we have a number of good training schools, but employment into government work, taking them up into, so that is one major vision we are working on, that a lot more pharmacists should be employed by government to work in our hospitals, so that we are able to offer better quality services to the Ghanaian populace. Our long-term plans are to be able to achieve parity, in terms of pay. Ensuring that the relativities that used to exist are restored. And it will satisfy everybody. If these relativities are there, we have agreed to them. We don't need to go and come back every now and then and be fighting over things. And so we hope that we'll be able to work with government to achieve some of these things. We want pharmacists to be found in key areas in the future. Clinical governance, very well, policy, advocacies, and even policy. Designing and coming out with policies. We want pharmacists to be involved. To be part. Yes. And when it comes to the implementation, we should also be found there. I've looked at the space. Hospitals are being put up. And sometimes when you go and look at the designs, when they say, this is the pharmacy, you go there and you realize that there are serious gaps. And you're asking yourself, which pharmacists did they consult in the designing? Because now then work becomes difficult with the kind of structure you have. When it comes to storage of medicines and all. You understand? And we think that in all these spaces, we should be found there, so that, for instance, government says I'm designing hospitals. They should consult a pharmacist, a chief pharmacist who knows. Who should be able to say that this is how pharmacies should look like in the hospitals. All these are things that we are working at. Ensuring, and when it comes to the employment, it's not just one-time employment that we are looking at. We systematically and continuously or continually, as it is being done for nurses and all that. Because attrition is always there. People are retiring, and so some more would have to fill the gap. 5 years ago, that pharmacists were actually employed by the ministry. And until today, no employment yet. So those who graduate end up in the private sector, basically or just all of them, or some hang around frustrated. Meanwhile, there is a lot of work to be done in the hospitals, and so there is one major thing that we hope to be. This is a clear-cut message to government. Government should see to the employment of more pharmacists. It is key. But along the line, we want to launch a mentorship and leadership grooming program. So to ensure that we still, just like you mentioned, gender issues, we can have a lot more ladies coming into the leadership, and then younger, ones also picking up. They can always start from somewhere, because we have regional setups where you can begin from, get to know the association well, how we operate, and then later you can easily become part of the national leadership and all that. So those are some of the programs that we have. These programs will look at how to groom young pharmacists into labor, into the labor front. Definitely, we are looking at it in two ways. You are looking at grooming them for the work itself, and then some also finding their way into labor issues. If I am to round up, I would say on our vision for the future, we want to develop a monitoring tool for policy implementation, because we should be able to see the impact of policies. Some that maybe have been advocated by ourselves. We should see how well these things are working, and so we think that we should be able to have. But by and large, welfare of pharmacists is the biggest goal of the work that we do as an association and as a labor union.
Great.
And so going forward, those are the things we are looking forward to. We hope to be able to find some good land, affordable for members to be able to purchase, not you maybe on
a high purchase
level, pay by installment. We are looking at having some amenities for them. I mean, currently we are even just looking at those ones may sound trivial, but they are important. If you are going to be able to have cheap source of data, connectivity,
for research purposes.
If we are able to arrange with the
for engagement as well, you call your senior pharmacist and facing issues with this. What advice?
So those are
areas that's
important areas. In fact, in the future, if we have the numbers, we think that we should be able to set up a tier 3 system for ourselves.
Pensions.
Yes,
I was going to ask you about pensions.
Yes, we manage it ourselves, and we ensure that whatever is coming, members can enjoy big time. So those are some of the things that
it's good that you brought in pensions. You are looking at pensions for your members. How do you see the current pension atmosphere in Ghana?
It doesn't look good.
Okay.
You look at the economy. You say you have worked for 30 years, 35 years, and you go on pension. And as a medical doctor, as a pharmacist, your monthly
pension
that is given to you cannot sustain you over the period of a month. Then what is the use of that pension? Because I believe in that old age, whatever is being given to you should be able to sustain you. If you're alone or even with your spouse, at least, you can forget about children because we think that is your old age. But at least you should be able to. And I doubt
whether it's happening.
No, what people are earning right now cannot take them anywhere.
So this is a clear message.
You cannot take them anywhere. And one of the biggest reasons why this is happening is because of the market premium. I think things will have to be consolidated. Then we contribute better. And so that when we leave, we can have enough for retirement.
After all, you work so hard. When you go to rest,
you deserve it. You deserve that rest, and you deserve to have something on you to enjoy.
Peaceful mind.
You don't go on retirement and then
you go and suffer.
You have to sustain yourself. That is wrong.
So we don't want Kofi Okuwu retirement. Our pensions must go up for us. Sir, your final words to your members.
Yes, I want to say that our dear gospel members, gospel has come this far. A lot of you who have come of age, you know what our struggles have been, and you will acknowledge that by the good work the past leadership and current leadership has put in, we have made some strides, we have made some gains, and we are looking to a better future where even more can be done. And so what we need from you now is your support. Rally behind us. In the near future, as we are looking forward to, we want to galvanize all members, discuss the way forward together. It will not be a vision of leaders alone, but the entire members coming together to decide what the way forward should be for our profession and our practice in the hospitals. And we believe that when you get involved and you share ideas, we will get the best. We put in place the right measures that will ensure that gospel becomes better, and all of us enjoy better welfare as we go along. And so we want to say support leaders to bring about the change we need so that our future will look brighter and be better than what it is today. This is what we will live with for all our members.
Great. That's a very powerful one. Viewers, all too soon, we have come to the end of another wonderful discussion. Thank you very much, Mr. Dafor, for sharing your insights and for walking us through gospel's journey. You know, your reflections have an have, highlighted not just the struggles, but the silent strength of pharmacists in building Ghana's health system. And to you, our viewers,
we are grateful for you having us on your show today.
Well, to you, our viewers, thank you for staying with us on Walatu, Walasa, where we bring labor issues into national discussion. I have been your host, Edmond Akwe, and I leave you with this quote in honor of health sector workers everywhere they find themselves. The dignity of labor lies not in the noise it makes, but in the lives it quietly saves. Until next time, stay committed, stay informed, and remember, where labor speaks, history lives. Thank you, and bye-bye for now.
Clog TV, beyond the policy.